All right, President Cyril Ramaphosa will address the nation at 8 o'clock tonight on South Africa's response to COVID-19. This follows a special sitting of Cabinet that considered recommendations from the Coronavirus Command Council.
All right, for what to expect from that address, let's chat to political analyst Professor Somadoda Fikeni and Professor Booysen. Ladies and gentlemen, very good evening to you. Thanks indeed for joining us this evening. I hope you don't mind, Prof. Fikeni. Ladies first. Prof. Booysen, what can we expect to hear from the President this evening?
Well, we certainly should be hearing a lot about avoiding that second surge. And yes, you've referred to that in your introductory comments on South Africans behaving or acting responsibly. And so they should definitely and will be very stern reminders that we can still avoid that, but that it depends on the population and responsible behavior. Simultaneously, we will expect to hear and are likely to hear many other measures on how the mitigation can be unfolding against severe unemployment, poverty, suffering, and escalated suffering that we've seen in the wake of the first peak of the pandemic. I'm sure the President will also be referring to new hope that has become evident with the early promising steps, still early, on the new vaccine that is being developed, and we heard many announcements about yesterday, and how especially in lower and middle income countries, which includes South Africa, the government would be able to help roll it out, and how the problems in that low temperature storage might be overcome in a country like that. And besides that, I really do expect and hope, also given yesterday's developments that we've seen in the ANC, that we will also hear from the President many more convincing, definitive reassurances as to how government will be acting responsibly and ensuring that all possible help will be flowing to people and needy people and not to rich public servants and politicians.
Yeah. Professor Fikeni, do you concur? I mean, there's been some speculation about a move to higher lockdown levels, but looking at the economic carnage already, the fact that prominent doctors are saying that won't help one iota, surely not.
Certainly, there is no possibility of going back to that severe restriction precisely because the balancing of livelihood and the balancing of saving lives has become the key issue now as we begin to understand the full implication of what has happened on the economy. So here he might just be trying to raise public awareness in terms of making sure that people still adhere to the restrictions and to all the protective measures. But more important, he might also be focusing, as Susan was saying, on mitigating factors as well as the economic stimulus, because the shift now is towards then after COVID-19, what do you do? He might use this opportunity perhaps to also pass condolences on the passing of the Auditor General, and he might also use a very carefully crafted language to refer to the fight against corruption, knowing very well that this is still a very sensitive and perhaps explosive matter within the ANC itself. At the same time, it's a necessary thing to mention in some form or shape.
Yeah. Well, can I just jump in there and say, what is the form or shape? Because obviously it's a party matter. The Secretary General has now been issued with a warrant of arrest. But I think even since the last address, his own spokesperson embroiled in a COVID-19 scandal. How do you think the President, Prof. Fikeni, should deal with that?
He could actually go ahead without mentioning names to say our fight against corruption will continue and therefore assure the public that money is being raised, even through loans, will be looked after, and the capacity of state to deal with these challenges will be coming. But at the same time, he could also try to assure people that government will not be embroiled in trying to solve politically that which is a legal problem once people are facing challenges, as was the case before. Because here in the public space and public discourse, there has been an effort, a strenuous one, to politicize and weaponize any legal action taken and sometimes factionalize it. The key issue is that the public could care less which faction is affected. They want to see that people who are involved in any corruption, face the law, and there are consequences to that effect. But at the same time, they are wary of any use for political purpose of the state resources.
Prof. Fikeni, I want to extend a similar question to Prof. Booysen on, how effective then would another talk on corruption be coming from the president this evening in light of what's happening within his own governing party, and in particular if you want to speak about ethical leadership, yet right on your own doorstep there seem to be troubles at home which others could perhaps argue are not being dealt with the way that they're supposed to be dealt with.
Yes, Griselda, I think we are bound to emerge in about an hour's time after that speech, with many questions and much discontent generally about what is probably going to be a severe limitation in the president's address. As Somadoda has remarked, the president is severely restrained in how much he can pronounce on what is the progress, because he has to be seen to be leaving steps to the legal process. Else he can fall into the kind of quagmire that we've seen President Mbeki fell into, former President Mbeki, around former President Zuma, and how the accusations of political interference will certainly surface if he steps in more definitively. And this is kind of this almost a political lockdown in which the president finds himself. He has to be seen to be definitive. He has to be seen to be leading this party and the different factions and the aberrant factions and the less clean than other factions in that party. And yet he cannot dare to overstep that mark and step from politics into the legal processes and be seen to be advancing those too fast, to be seen to taking sides in that, because that is going to come home to haunt him again. So it is really, really caught between a rock and a very hard place for the president this evening. And yet we will expect him to, because after all, he is president, he is leader of the government, even if he has to tread very, very carefully in relation to the ANC, there's slightly more leeway for him to ensure that very strict measures, definitive measures, are enforced when it comes to public service and politicians deployed into public service.
Professor Fikeni, let me throw a question to you, and then we're going to bring up some tweets, the chatter amongst prominent South Africans tonight. But on that issue, surely there should be some news on the SIU that they were sent to go and look at COVID-19 corruption. Do you think he could have some good news there? This whole issue is thorny because it's not only the ANC, but what about the ministers and ex-ministers being implicated in the Zondo Commission as well?
Well, I do think that he might feel a lot more comfortable on the COVID-19 related corruption for a very simple reason that, one, it is recent and it implicates even some of the people who are closer to him, as a way of signaling that it doesn't matter whether you are close to me or you are in the other faction. The fight against corruption will not discriminate. And besides, the public is expecting answers on all investigations around COVID-19 and the PPE scandals, because they are current and they are happening in real time at this particular moment. So he cannot avoid doing that, but it also has a very subtle political function of saying, it's not only what is coming out of the Zondo Commission, but it's also what has just happened now. And some of the people might be my political allies, but they'll be subjected to the same process. So that in itself, I think he might be bolder pronouncing on that than on the other ones, such as the asbestos issue in the Free State. But there is yet another issue that Susan raised, which I think I will touch on, the issue of vaccine nationalism. That one is a very important global issue that is beginning to come up, where some big powers are beginning to say we will hold on to some of the vaccines. So he may find a way of expressing himself on that one. And by a long shot, he might even try to reiterate his congratulation of Joe Biden, because remember that Donald Trump had a disdainful indifference to Africa and South Africa. That's why it took so long for him to even appoint an ambassador.
Prof. Fikeni, I think I want to bring in some viewer engagement just very quickly. If we could ask our team just to bring up, some of the comments that are coming in from some of our viewers. Eugene Mutsabi, you saying bring back the curfew on this matter and taverns to operate from 9 until 2200 hours. Eugene, thanks for your speculation, I guess, on perhaps what the president will say a bit later on this evening. Chinokwetu Tawanda saying, as a foreigner residing and working in South Africa, I'm hoping that Mr. President will not tighten the international travel restrictions, since we all want to go see our loved ones back home and come back. Chinokwetu, I think that will be quite one that the South African government would need to measure, given that, in some countries there are, other restrictions that have been put in place. So South Africa would need to look at what will be viable for it at this particular stage. And Paladi, Francis, you take that one.
Saying interprovincial restriction towards the festive season, and maybe we can throw this to the analysts. I mean, could you imagine the devastation, tourism? So let me ask you, Prof. Booysen, tourism has just opened up, so surely sort of blocking off interprovincial travel, that could be devastating for small businesses that are trying to hang on to those jobs. We know there are some restrictions on international travel. Just tell us more. Do you expect maybe tweaks around sort of the gathering size, the number of people that can get together, things like that?
Yes. It is certainly a big problem, the opening up and how it clashes with economic activity and livelihoods. And I really think there is no going back at this stage. But what I expect to be emphasized very strongly is enforcement, is doing social distance and hygiene, all the usual hygiene routines, but yet not opening, not closing up those economic operational spaces again, especially not when so much of the tourism industry is really destroyed. And it's such a need to get those livelihoods going again, because employment, a high level of employment in that sector can contribute quite a bit to sustaining livelihoods. So I know it is a very difficult issue to go back and whether they should be going back, but I do not think either government or the economy can afford going back at this stage. And so I think there will hopefully be continuous progress, but again with that emphasis that it depends on citizens, their responsibility and their maintaining safety measures, so that we can get a balance between these factors. We have seen, for example, in European countries, several other countries that have been experiencing second big surges. It followed in the wake of sort of don't care, laissez-faire attitude, people not acting at the levels of responsibility they had when the first surge was brought under control. So I think it will be a big emphasis on striking that balance and avoiding going back into higher levels of lockdown.
Prof. Fikeni, if you talk about, for example, enforcement, if the president says this evening you need to behave, or else, how difficult would that then be to police in terms of, resource? We've seen, since the start of the lockdown at level 5, there already been challenges in terms of enforcing, some of, the issues that government had put on the table to deal with the further spread of the coronavirus.
Well, I do think that it is always a very difficult one to leave it to law enforcement alone, because you need to have public suasion and public internalizing some of the messages so that they can see the benefit out of it. And it might even be worse when it comes to December. I know that we often talk of tourism. South Africa tends to be moving in all directions. In the first instance, you do have immigrant communities coming from neighboring countries. When it comes to December and end of the year, they move en masse, hundreds of thousands, into their various, countries of origin. Within the country itself, you do have massive migration that goes to rural areas from urban working centers. And you also have people who had postponed traditional initiation ceremonies, weddings, and many other things, and some who could not do all the rituals around burials, who may try to concentrate or actually bring most of these during the festive period. And that's when you are likely going to have the problem of enforcement and the possibility of a second wave.
Prof. Fikeni, you mentioned the economic recovery plan earlier. The same question I posed to our economist earlier. This wasn't a long-term plan. There were meant to be quick gains from this economic recovery. South Africans were meant to see this in action. Do you think that he can talk about anything tangible tonight?
Well, I do think he may allude to some of the meetings he has had around long-term infrastructure investment and around some of the efforts to have efficiency in the state expenditure. Because what is facing our government and leadership is a dilemma. Do you go for austerity and severe restrictions under the guise of improving efficiency and therefore strangle the economy not to grow? And in the process of trying to signal to your lenders that you have fiscal discipline? Or do you stimulate your economy by spending and borrowing even more in order to make sure that you grow your economy in the long run? And how do you sequence and prioritize those? Those are some of the key questions that he has to be looking at. But at another level, though, some of the intervention measures to mitigate this disaster were short-term. Some were not even well implemented, as you saw the UIF and many other, challenges. And he may be speaking to those. And some he made a promise as to what would be implemented. But up to this point, either because of the state capacity or because of the shortage of resources, those have not come to be.
All right, let's bring in some viewer engagement as well. Let's bring up some of those tweets from some of our viewers. Thank you very much indeed for engaging with us here on the program as well. Malefetsane says he will focus more on COVID-19 restrictions for festive season, hoping he will put more measures in place. Malefetsane, thanks indeed for engaging with us tonight. Let's have a look at another one as well.
Ishwena, nothing new, probably stricter lockdown rules because the stats are picking up rapidly. That is an interesting assertion. Yes, there have been some pickups in the numbers, but looking at it, and I don't know, both profs, if you'd like to jump in here, 2,000 below, 1,700 or so, 1,300, those are the sort of numbers over the past few days. Nothing like the 13,000 or so per day at the height of COVID-19 in South Africa. You also have prominent doctors saying it won't help. And here again, maybe starting with you, Prof. Booysen, government is having to make huge decisions, sometimes with huge economic implications on science that's not always definitive on what's going on and why we're seeing the infection rates we're seeing and how everything sort of fits together.
Yes, indeed. We've seen variations at a level slightly higher than what had been hoped at this stage in recent weeks. But again, it's in that 1,300 to 1,700 range so far, not jumping out of that range by much. So it could be that one can argue it is satisfactory to see things stabilize at that level. However, if there is any indication that it goes, for example, over the 2,000 new cases per reporting period, that would definitely be a sign to get higher levels of lockdown reintroduced. But we've seen even yesterday and today, the experts who are also advising government, they seem to be satisfied that the levels of new infection have been stabilizing at that 1,400 to 1,700 new cases level, and that is high, but as you remark, indeed, it's not near where it was at the peak times. And so that would have to be part of the message this evening, to restrain, to limit it, to ensure through social behavior, responsible social behavior, that the levels stay contained and not bouncing out of that range.
All right, we are hearing that the President will be addressing us very shortly. We're hearing from our teams at the Union buildings that he's just about to get ready, Francis, to do that. So as soon as he addresses us, you'll forgive us to both the profs. We might just need to just cut you off there and bring you back again once the President is done.
Yeah, maybe in the last minute or so, Professor Booysen, short and sharp, what do you expect on the economy?
It is so difficult to say, but it will have to be definitive. It would have to be on a level of looking after the most needy in society, ensuring that that kind of suffering that was brought
Professor,
by COVID.
I have to cut you off there. We are
Sure.
expecting that address to start imminently. Let's see if we can take you live to the Union buildings.
Fellow South Africans, we have not had our national family meeting for quite a while now. It has been many months now since the outbreak of the coronavirus in South Africa. The pandemic has caused great hardship for all our people. After such a long time of uncertainty and worry, we all wish to return to our normal lives. I know that many of us are suffering from coronavirus fatigue. The problem is that we've begun to forget that the virus is still present all around us. As I speak to you this evening, the COVID-19 pandemic is worsening across the globe. The world has just recorded its highest number of weekly new cases since the start of the pandemic, and the highest number of weekly deaths. More than 51 million people have been infected globally, and at least 1.2 million people have died. Many countries are in the midst of a second wave of infections, which has often been more severe than the first. What we are seeing brings home a very difficult truth, that COVID-19 is far from over. It is very much still here, and it will remain with us for some time to come. As South Africans, we have endured what we hope is the worst of the storm. At the height of the pandemic in July, we were recording around 12,000 new cases of infections a day. For more than 2 months now, the number of new infections has remained relatively stable at below 2,000 a day. The number of deaths has been declining steadily, as has the number of people requiring hospitalization. The total number of new hospital admissions has also declined for the 14th consecutive week. We owe this to the decisive measures that we took early in the pandemic and to the contribution that every South African has made in fighting this virus. We owe this also to the frontline workers who have selflessly and steadfastly and also courageously staffed our medical facilities, gone out into communities to screen and to test, who have also had the courage to continue serving our people. And in doing so, we know that our people have benefited a great deal. For more than 2 months now, yes, the virus has declined significantly. And as it has declined, we have also been praised by many people around the world. We should be proud of our response as a nation, which has been widely recognized and been commended. I had a virtual meeting yesterday with several international business leaders whose companies operate in many countries across the world. They all applauded the manner in which South Africa has managed the pandemic. While this is welcome progress, we must, however, acknowledge that this pandemic has so far taken a great toll on the health and well-being of our people. To date, South Africa has recorded more than 742,000 coronavirus cases. Of these people, over 92% have recovered from this disease. This is a phenomenal achievement. But the greatest blow we have suffered since the start of this pandemic are the confirmed deaths of 20,011 people due to COVID-19. While we have a relatively low fatality rate compared to many other countries, we cannot begin to calculate the loss as well as the anguish that these deaths have caused to families and to the friends of those who have departed. Since the beginning of this crisis, our goal has been both to save lives and to protect the livelihoods of South Africans. As we rebuild our economy in the midst of this pandemic, this must remain our overriding concern. Although infections have stabilized, many people are still getting infected every day, and we remain vulnerable. We are seeing now how quickly and how dramatically infections can rise in a number of countries. We are also seeing how health systems can become overwhelmed in the face of rising infections. The rise in infections in some of these countries has led to the reimposition of tough restrictions. We have also seen in other countries how a resurgence can dash the hopes for a swift economic recovery. We must do everything that we can to prevent this from happening in South Africa. If we are to prevent a resurgence of infections in our country, there are a few areas that we must pay attention to. The first is the situation in the Eastern Cape, which is showing signs of a resurgence. In the last week, the number of new cases in the province was 50% higher than the week before. This is concerning. And the total number of new cases in the last 14 days was around 145% higher than the previous 14 days. These increases are being driven by massive spikes in the Nelson Mandela Bay Metro and the Sarah Baartman district in particular. For the last month, there has been a sustained upward increase in hospital admissions in the province. The evidence suggests that the increases in the Eastern Cape could have been triggered by outbreaks in institutions of higher learning, such as universities, and also in schools, and attendance by people at large gatherings. When this is combined with poor adherence to social distancing, mask wearing, and other poor hygiene measures, the environment is rising infections is set. With many people moving between the Eastern Cape and other provinces, particularly the Western Cape, it is a matter of time before this surge spreads to other parts of the country. We therefore need to take measures to contain this rise in infections. In response to the rising infections, we are implementing the resurgence plan that has been developed together with the surge team that was deployed to our country by the World Health Organization. Interventions that we have come up with include primary healthcare outreach teams to intensify contact tracing, daily community mobilization, ensuring the readiness of health facilities in the province, and being ready to respond to possible cluster outbreaks. We will be working closely with the provincial government, also with municipalities and other institutions in the Eastern Cape in the coming days and weeks to ensure that this surge is contained and managed. What we are witnessing in the Eastern Cape should, in essence, be a wake-up call to all of us that we cannot relax and we cannot be complacent about our approach to COVID-19. We are therefore also closely monitoring developments in areas that are experiencing higher than average rates of new infections. The areas where we are experiencing higher than average rates of new infections include Lejwe and Mangaung in the Free State, Francis Baard and Pixley Kaisa-Kaseme in the Northern Cape, and the Garden Route and Cape Town Metro in the Western Cape. To ensure that we can keep all the necessary prevention measures in place, we are, as required by the Disaster Management Act, extending the national state of disaster by another month to the 15th of December 2020. The second area of concern that we need to pay attention to is the upcoming festive season in our country, during which time many South Africans travel to other parts of the country and where people tend to relax and to gather socially. These activities, if not undertaken responsibly, pose the greatest immediate threat to our management of the pandemic. But we can avoid a second wave if we each play our part, if we remember what we need to do to keep ourselves and others safe. From the big cities and the metros to the smallest towns and villages, we all know about this virus. Information about this virus has been abundantly socialized among South Africans. From the grade R learner to the factory worker, from the university student to the grandparent at home, we all know how the coronavirus can be spread. So what I'm asking of each and every one of you this evening is not something new. I'm asking you to do what we all know must be done. We know that this virus is transmitted when we are in close contact with other people. Let us remember that it is transmitted in small particles from our noses, from our mouths, when we speak, cough, sneeze, or even breathe heavily. We also know that we need to protect ourselves and those around us. We also know that we need to wear a mask. A cloth mask worn over the nose and the mouth is still one of the best defenses against the spread of coronavirus. Now, I know that this can at times be a hassle. Masks can be hot and they can be cumbersome and uncomfortable, particularly during the summer months. Masks also make it difficult to recognize other people or to hear clearly what they are saying. I've also had difficulty in recognizing some people when they are wearing masks. But cloth masks are cheap. They can now be found almost anywhere in our country, and the inconvenience of wearing one is far, far, far better than becoming infected or infecting others. Wearing a mask every time we leave home is far, far better than having a second wave. It is also far better than a return to lockdown and better than having to shut down our economy once again. A number of outbreaks have been linked to indoor gatherings where there is poor ventilation and where there is no social distancing. Of course, with the festive season approaching, it is understandable that we all want to be with family, we want to be with friends. It has been a stressful and traumatic year that we have all gone through. We want to socialize, we want to connect with each other and forget the troubles and tribulations of 2020. But this does not mean that we should let our guard down against this virus. We must remember that every additional person we come into contact with increases the chances of transmission. We should seriously avoid large gatherings. We should rather meet in small groups, and if we go out, we should limit contact with others. I have personally been increasingly getting concerned and alarmed by what I keep seeing in social media and on television, where people are holding big parties, where they go to big gatherings and social events as though the virus does not exist, where they go to shebeens and taverns and dance up the whole night as though the virus does not exist. I've been seeing images of indoor venues crowded with people who are not wearing masks and with no evidence of social distancing. These are super spreader events that must be avoided because this is dangerous behavior. The same rules that applied in the early days of the lockdown should also apply now. And now that we are in summer, it is far easier to meet outdoors or in rooms with windows that are open to allow ventilation to come through the rooms. As we have said before, we need to utilize various tools in our coronavirus toolbox to fight this virus. We can also use technology to fight the virus. I call on every South African to join the 700,000 South Africans who have downloaded COVID Alert as a mobile app. The COVID Alert app can notify you if you've been exposed to the virus, whether it is in a taxi, a shopping mall, or a social gathering. And it does so without sharing your location or any of your personal information. The app is zero-rated by mobile networks, so it won't cost you anything to protect yourself and others. By downloading this app, you help to make the virus visible and break the chain of transmission. We would like, therefore, to appeal to all organizations to encourage their staff, to encourage their visitors, to download the app when they enter their offices, their shops, their schools, universities, or other enclosed facilities or spaces. In addition to these actions, we should all take to prevent a resurgence. We are strengthening our public interventions with regard to health. Testing is essential if we are successfully to prevent a resurgence. Without the severe capacity constraints we have had a few months ago, we are now working to significantly increase the number of tests that are done each day. All hospitals, both public and private, should test hospitalized patients in line with the revised guidance. We will also be expanding community screening and testing in hotspot areas. An effective and safe vaccine is still our greatest defense against COVID-19. And there are now several candidate vaccines in development across the world. Equitable access to an effective vaccine is vital to the successful containment of this pandemic. Earlier this week, the world witnessed a game changer in the world of science regarding the development of a vaccine. This is the first evidence that an effective vaccine against coronavirus is possible, and that the preliminary data from the research suggests that it may be more than 90% effective. Now, this changes our perspective on the future of the coronavirus pandemic. This development brings new hope in our fight against the virus. South Africa is collaborating with several multinational pharmaceutical companies to obtain a safe and effective vaccine for our people, and we are contributing towards the availability of a vaccine in the rest of the continent. We are working through the Africa Centers for Disease Control and Prevention to acquire and to fund a vaccine for the African continent. It is estimated that our continent, Africa, will need around $12 billion and 750 million doses of an effective vaccine. Earlier this week, in my capacity as chairperson of the African Union, I established the COVID-19 African Vaccine Acquisition Task Team to lead this effort. Our Minister of Health, Dr. Zweli Mkhize, will serve on this task team together with other outstanding citizens of our continent. South Africa has also been appointed as a co-chair of the global ACTA initiative that is facilitating access to innovative interventions, including vaccines, for all countries. Countries are going to have to allocate funding so that there can be access to vaccines to prevent the further spread of the virus. In recognition of our country's manufacturing capacity, one of the leading pharmaceutical companies in the world, Johnson & Johnson, has entered into a preliminary agreement with a local company, Aspen Pharmacare, to manufacture and package its candidate vaccine. Aspen has capacity to manufacture 300 million doses of the candidate vaccine at its Nelson Mandela Bay plant in Port Elizabeth. This life-saving medical product will be needed across the world, and it will be manufactured here in South Africa by South African workers. And obviously, we are bidding very hard to have an uptake of the product that will be produced here in our own country. This is in addition to the progress made by BioVac, a local biopharmaceutical company that is in partnership with the South African government. BioVac is in advanced discussion with an international vaccine manufacturer that would also enable it to locally manufacture a COVID-19 vaccine to ensure sufficient supply for our country and to our continent. Fellow South Africans, from the outset of this crisis, we have sought to both save lives and protect livelihoods, as we have said. That is why in April we introduced a massive economic and social relief package to limit the effects of the pandemic on companies, on workers, on households, and on our communities. This intervention was essential to keep our businesses afloat, to protect jobs, and to prevent millions of people from going hungry. Now, as our economy has been steadily opening up and that restrictions are being lifted and movement and activity has been eased, we have been able to turn our attention from these emergency measures towards an ambitious plan of economic reconstruction. Through the various interventions that we are making to deal with COVID-19, we are also shifting from relief to recovery. As the economy starts to recover, many of the measures in the relief package are steadily being wound down. We are trying within our limited resources to ensure that this is done in a gradual manner. We recognize that some industries are still not able to operate fully and that it will take some time for many jobs to return. That is why we extended the special COVID-19 grant for a further 3 months until January 2021. This will provide much needed income to around 6 million people who are unemployed and who do not receive any other form of government assistance. Following extensive discussions with our social partners, the UIF will extend the COVID-19 UIF TERS benefits scheme by another month to the 15th of October 2020. Discussions continue with our social partners on support measures for businesses in distress going forward. Always mindful of the need to ensure that the UIF has sufficient funds to meet the anticipated rise in unemployment claims that will definitely come. The COVID-19 UIF scheme has already paid out nearly 53 billion to over 4.7 million workers. These relief measures were necessary to protect those who are most vulnerable in a time of great distress, but they will have to come to an end, as we do not, as a government, have sufficient resources to continue. The relief package has laid the foundation for a robust economic recovery, limiting job losses and keeping afloat many businesses that would otherwise have been forced to close. As we transition to a new phase in our response, the only way forward is a rapid and sustained economic recovery. We are therefore working to enable all parts of our economy to return to full operation as quickly and as safely as possible. We are amending the Alert Level 1 regulations to restore normal trading hours, for instance, for the sale of alcohol at retail outlets. We are also opening up international travel to all countries subject to the necessary health protocols and the presentation of a negative COVID-19 certificate. Now, by utilizing rapid tests and strict monitoring, we intend to limit the spread of the infection through importation by those who will be traveling to our country. We expect that those measures that we are going to take will greatly assist businesses, particularly in the tourism and hospitality sectors. We are focusing relentlessly on the implementation of our plan, pursuing a few priorities with the highest impact and ensuring that we deliver on these. Our infrastructure program, as announced, continues to gather pace and momentum with the strong support of the private sector as well as development institutions. Many programs supported through the presidential employment stimulus have already started, and recruitment for others has already begun. Among these, the Basic Education Department has opened recruitment this week for teacher and school assistants, targeting unemployed youth in every province. Next week, we will be holding our third South Africa Investment Conference, which is an important indicator on the country's continued value as an investment destination for both local and foreign investors. We're delighted that so many companies that made commitments and pledges in the past are coming back to participate, and new ones want to come back to participate. This is a clear demonstration that South Africa is indeed a land of opportunity and a land where we can still continue to attract investments. We will continue to drive progress on the reconstruction and recovery plan, including through the implementation of structural reforms to shift our economic trajectory. Through our actions now, we can ensure that we remain on the path to recovery. My fellow South Africans, we have lost many lives to this pandemic. Many of us have had to bid farewell to a loved one, a friend, or a colleague. As we look back on the year, it's been a year of much pain and sorrow. It is important as a nation that we should honor and remember all those who have succumbed to this disease. It will be appropriate, therefore, that during the 16 days of activism for no violence against women and children, which is the second pandemic we are confronting in our country, as I said, that we should demonstrate our remembrance of all those who have departed due to COVID-19, but also due to gender-based violence. Cabinet has decided that from the 25th to the 29th of November, the nation should embark on 5 days of mourning for the victims of COVID-19, as well as for the victims of gender-based violence and femicide. We will let the national flag fly at half-mast throughout the country from 6 a.m. to 6 p.m., from Wednesday, the 25th of November, to Sunday, the 29th of November. We call upon all South Africans to wear black armbands or other signs of mourning to signify our respect for those who have departed from amongst us. We call upon all South Africans to demonstrate their solidarity and to do this in remembrance of our countrymen and women, in recognition of the grief that we share as a nation, and as an affirmation of our determination to overcome this devastating disease. Fellow South Africans, as I address you this evening, the country has just received the deeply sad news of the passing of the outgoing Auditor General of our country, Mr. Kimi Makwetu. During his time as Auditor General, Mr. Makwetu served this country with dedication, with distinction, and with great integrity. Our thoughts and prayers are with his family at this time of great sorrow. As a nation, let us continue to do what we know we must do to keep ourselves safe, but more importantly, to keep those close to us safe as well. Let us continue to demonstrate that we are a people of resilience and courage. Let us show that we care for one another in sorrow, in sickness, as well as in death. It is our individual actions over the next few weeks and months that will decide the fortunes of our nation. The actions we must take are straightforward, but they are not insignificant. They can and do save lives. Let us continue to work together like the great South African family that we are, to restore, to recover, and to rebuild. May God bless our beautiful country, South Africa, and protect her people. I thank you.
All right, the address by President Cyril Ramaphosa this evening to the nation. Some of the notable points, Francis, coming out. The President calling, of course, for that National Day of Mourning between the 25th and the 29th of November, asking us all to wear those black armbands, in honor of those who passed on during this very difficult time, the outbreak of this a global pandemic. And Francis, that National Day of Mourning for those days coming at a time as we're also hearing breaking news now of a very prominent South African, former Nelson Mandela Bay Mayor Mongameli Bobani, an announcement just a couple of moments ago of his passing. He had been in hospital on a ventilator, also contracted COVID-19. We're seeing amongst the tributes coming in there from the UDM's Bantu Holomisa on that. So as the President is